What's up, you guys? Thanks for stopping back to my YouTube channel. And if you clicked on this video, then you most likely are experiencing heel pain in the morning when you first wake up and get out of bed, or if you've been sitting in your car for a while and you get out of your car, those first few steps you may experience heel pain. Well, this is something called plantar fasciitis, and I'm going to give you 3 tips on how to get rid of this problem. And if you stick around for the whole video, I will tell you when it's time to see your doctor if it's not getting better. So first of all, what is plantar fasciitis? It's basically an inflammatory condition of a band of tissue in your arch known as the plantar fascia. And this band of tissue originates on your heel bone, it extends out through the arch, and then it fans out into your toes. And overuse can create an inflammation of this tissue, much like tendonitis, and it creates severe pain on the bottom of your heel, and it's very stabbing. Some patients think they might be stepping on something or they broke their heel. It can be a very severe pain. So the first step to getting rid of heel pain is stretching. Now, there are various ways that you can stretch, but I want to stress that you're not stretching the foot, you're actually stretching the calf muscle. So this stretch is something called a runner stretch. You're going to stretch the gastrocnemius muscle, which is on the back of your leg, and you're doing this by performing 3 sets of exercises or stretches where you're stretching this calf muscle, holding that stretch for 30 seconds, and you want to repeat this 3 times, and that would be considered 1 set. And you're going to do that 4 to 5 times a day, and this helps to increase the flexibility of that muscle, and by doing that it takes the tension off of your plantar fascia. So that's one way. Another way that you can stretch is by wearing something at night called a night splint, and this is something that you would sleep in, and it holds your foot in a 90-degree position because most of us sleep with our foot in a plantar flex position, and this causes that muscle to tighten or to contract over time. So this night splint will keep the foot at 90 degrees. And if you're interested in a night splint, I have the link in the description below and directs you to a place where you can find a night splint that you can sleep in. This is something that doesn't need to be prescribed by a physician. Another option is a stretching platform. These are like a heel wedge stretching platform that you can buy, and it's kind of like a rocker bottom stretching device. These are something that can help to stretch the gastroc muscle, and it's kind of like an active stretch. You're rolling it. Again, I've placed it in the description below. There's a link if you want to get one of these. Some people will talk about stretching or massaging their arch with a tennis ball. You can do that, that'll work, but you're not actually stretching the calf muscle. You're actually putting some pressure on the plantar fascia by rolling it over a tennis ball. Some patients find that very successful. There are other options that you can buy. There are massaging devices that you can buy where you're rolling this over your arch, something that you might want to consider trying as well. The second step to getting rid of plantar fasciitis is by treating the inflammation. And you can first start by treating the inflammation with an anti-inflammatory pill that we refer to as a non-steroidal anti-inflammatory, something called ibuprofen, which is Advil. Now you want to make sure you check with your physician so that you can take these. You want to make sure that they're not bothering your stomach, because if you're taking these medications and you have any stomach problems or gastritis, it can create stomach lining irritation. So you want to take Advil according to the recommended dosage on your bottle, or if it's prescribed by a physician. That's the first way to treat the inflammation. The second thing you're going to do is use ice. Ice is a very great anti-inflammatory. It actually has physiologic effects. It's not just cooling the area down and making it feel better or numbing your heel. It's actually treating it physiologically. And you're going to do this by applying the ice for about 20 to 30 minutes. You don't want to go longer than 30 minutes because it can create a thermal burn to your foot. And some of my patients will tell me that they don't use ice because it hurts. And that's true. The first 7 to 12 minutes you'll experience pain, and then a response kicks in where your body inhibits the pain, and that's where that cooling effect occurs, and that's the physiologic process that helps ice to heal this area. So what you want to do is make sure you're getting past that 7 to 12 minutes, and that's where the therapeutic effect kicks in. So if you can keep it on for up to 25, even 30 minutes, that will help cool the area down and treat it as an anti-inflammatory. And you can do this several times a day. There's no recommended amount. You can ice as much as you want. Sometimes we'll even say each waking hour you can go through this regimen of icing. Some patients like to use heat. I would tell you heat can be an absolute no-no. If you're using heat, it can increase the inflammation, and remember, this is an inflammatory process, so by adding heat you can maybe short-term make it feel better, but long-term it's going to bring on more inflammation, which can create more pain. So you don't want to use heat when treating your plantar fasciitis. The third step to treating plantar fasciitis is shoe gear. You want to make sure you're wearing sensible shoes. Now, I'm a big fan of functioning barefoot because it can strengthen the foot, but when you're dealing with plantar fasciitis, you want to make sure that you have a sensible shoe on that's providing some cushion to your foot and giving it some support. It's controversy as to whether you need a lot of arch support, so the first thing that you want to do before going out and getting an orthotic is just trying a comfortable shoe. So what are these shoes? One of the brands of shoes I recommend is called a HOKA. Now this is a large over-cushioned running shoe that gives you a lot of cushion, but it's built on a platform that doesn't have any elevation in the heel or height changes. When you start to elevate the heel, you're putting undue stress on the foot, causing your body to function in a manner that's not anatomically normal. And HOKA has created a shoe that offers you a lot of cushion without a high heel. Although it looks like there might be a heel, there's actually not. So this is one of my favorite shoes that I like to refer to as a recovery shoe. It's kind of a cross between a cam walker that we use after surgery and an athletic shoe. So I have a link in the description below where you can find some of the HOKAs that I recommend. They come in this cool white color. You can also get a nice black color that's a little bit more fashionable or less trendy. Another brand of shoe that I recommend are Brooks. They kind of make these cool, trendy shoes that I like to wear in the office. Brooks make a great running shoe. They're a little bit different than HOKA because they have more of a heel height, but again, there's not a lot of arch support or stability in these shoes, which are great for plantar fasciitis. They also make some cool red, white, and blue ones with stars and stripes. Brooks actually makes a pair of running shoes for each holiday that's out there. So they have Christmas shoes, Thanksgiving shoes, St. Patrick's Day shoes. Again, I've got a link in the description below if you're interested in Brooks running shoes. So what about orthotics? Well, there's two options for orthotics. You can get a custom-made orthotic that's specifically made for your foot, and that's done by taking impressions or molds of your foot. It's then sent out to a lab, and that lab constructs an orthotic device that's made only for your foot. Or you can get an over-the-counter orthotic that fits into your shoes. Which one's better? Well, the literature is kind of mixed in this, and it's very controversial. So I'd first recommend trying an over-the-counter orthotic, and sometimes these work well for plantar fasciitis, and sometimes they don't. So I don't want you to think that it's necessary to buy an orthotic, but sometimes you may want to try one because they can help. I've put a link in the description below to an orthotic known as the Step Orthotic, and that's something that we dispense in our office. So if you've tried these 3 steps that I've recommended and you're not seeing any relief, the next step is to get into a doctor. The first thing that we do in the office is try cortisone injections. We can do a series of 3 of these over a 6-week period, and usually this will help to treat the problem and cure it. Many people think that cortisone is a temporary fix for this. It's actually a cure because we're treating the inflammation. Now, if you've failed 3 cortisone injections, you may be one of those people that just do not respond to the injections and you have a chronic plantar fasciitis that may need surgery. And we have a new innovative way of doing this type of surgery, and it's very simple, and we're basically just performing a tiny incision. We're using a camera and we're making a cut across the plantar fascia to relieve that tight tension. This is a simple procedure that's done as an outpatient. You're off your foot from anywhere from 1 up to 3 weeks. You don't need crutches. Patients are healing very quickly. It's different from when we used to perform an open procedure where we had to make a longer incision. So if you've failed everything and you've been treating plantar fasciitis for over 6 to 8 months, you may need surgery. And if you're interested in this procedure or you're worried that you may be at that step, you can click on the link I have above. It'll show you the entire endoscopic plantar fasciotomy surgery that I perform with the use of a camera intraoperatively, and we've demonstrated this entire video so that you can watch it so that you're not nervous about having this procedure performed. And again, patients are back to activity quickly. So that's it. Thanks for watching this video. I hope these 3 steps help for you to get rid of your plantar fasciitis or heel pain, and stay tuned for more upcoming videos. If there's any questions, leave them in the comments section below. You can check out some of these other videos I posted. Make sure to hit the like and subscribe button. That helps to keep my channel going, and we've created a ton of videos. And if you like these videos and you comment below, we'll keep them going and we'll keep posting more of these awesome videos that we've created. And if there's anything you'd like to see or questions for me or anything you want me to talk about, leave it in the comments section below.